type 2 is when you grow older and you put on weight and the insulin is there, but it is falling deficient because it is not efficient. And the common diabetes is the type 2 diabetes. Now in type 2 diabetes, which is 90% of the times, 10% is only type 1. So we will discuss type 2. In type 2 diabetes, what has been found is that for every 1 millimicro per liter of TSH rise, there is an increased incidence of diabetes.
सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में।
हेलो नमस्ते, वेलकम टू आवर चैनल सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में। मेरे साथ है डॉक्टर निखिल।
नमस्ते।
तो पिछले एपिसोड में हमने डिस्कस किया लम्प्स दैट अपीयर इन डिफरेंट पार्ट्स ऑफ द बॉडी। तो आई थिंक आज उसी के कंटिन्यूएशन में हम आज डिस्कस करेंगे।
So in the series of lumps, we will now discuss lumps in the area what is called as head, face, neck. So the neck and the head and the face. Okay. So let's divide it into two parts. The commonest lump that we see in the neck is the enlarged thyroid gland, which is also called goiter. Goitre. Okay. And then we have other lumps in the neck, which we will discuss in a separate episode. So what is thyroid? It is a organ where both surgery or surgeons and physicians or physician colleagues, actually the endocrinologists, they are specialists in diseases of endocrines like the thyroid gland, the pituitary gland, the adrenal gland, the pancreas. These are all endocrine glands. So what are endocrine glands? They produce hormones which are secreted directly into the blood. So you have endocrine which secrete hormones directly in the blood, and exocrine. So what is the example of an exocrine gland? Salivary gland. It produces saliva, but it has got a duct. So those glands which are without duct and produce something which is directly secreted into the blood are called endocrines. So the endocrine system consists of the hypothalamus, pituitary, the thyroid, the adrenal, the genitals, that means the testes or ovaries, and the pancreas. Okay. So those specialists who are specifically trained after internal medicine, another 3 years, only the disease of these organs. The commonest disease or the two most common diseases is diseases of the thyroid gland and diseases of the pancreas, which is diabetes. Because insulin is a hormone, and thyroxine, which is the secretion of thyroid gland, is also a hormone. So what does thyroxine do? Thyroxine basically is secreted from the thyroid, and what it does is it controls metabolism. Now what is metabolism? The normal temperature of the body, the heart rate of the body, the blood pressure, then the wakefulness, that means whether you sleep or you don't sleep enough, how much you sweat, the rate of the movement of the intestine, which is called peristalsis. All these things are controlled by thyroxine. Now basically you have two types of thyroid disease. Okay, one is hyperthyroidism, where the amount of thyroxine produced in the body is more, and hypothyroidism, where the amount of thyroxine produced in the body is less. Okay, so today's episode we are going to discuss a little more about physiology of thyroid, because it is important. Why? Because it is very common in a lot of people. So I thought that we will devote some time to explain the connection between thyroid and other diseases.
Sure.
So hyperthyroidism is less common, but hypothyroidism is far more common. Okay. So how does the thyroxine get produced in the body? So first there is a hormone which is called as the TRH, that means thyroid releasing hormone or thyrotropin releasing hormone, which is produced in the hypothalamus, which is inside the brain. So remember RST, the alphabet TQRST, so RST.
Okay.
So TRH is the basic hormone which acts on the pituitary gland. Now the pituitary gland is a small gland at the base of the brain, and it is the center of a lot of hormone function. All the releasing hormones or the stimulating hormones are released in the pituitary. It is an anterior and posterior. So the TSH or thyroxine or thyroid stimulating hormone is released from the anterior pituitary in response to the TRH. So the hypothalamus produces T capital RH, releases T capital SH, which releases thyroxine, which is capital T. So remember RST, releasing hormone, then stimulating hormone, and finally thyroxine. So it is known as the pituitary thyroid axis. Now why is this important? The level of thyroxine will determine the level of TSH. So if the thyroxine level is normal, TSH is normal. Both thyroid and TSH are measured by blood tests. So you have TSH level, T3 and T4 level. What is T3, T4? Thyroxine in the body is produced as T3 and T4, but T3 is the active form. So T4 in the body gets converted to T3 and then it acts on the body. So both T4, T3 levels are produced, measured, and TSH is measured. Now if thyroxine level comes down, that is hypothyroidism, the TSH level will go up as a response, because the brain feels that there is not enough thyroxine in the body, therefore it tries to produce more. In trying to produce more, the thyroxine level goes up. Now the level of TSH going up is a sign that you may be having hypothyroidism. Okay. Now this TSH is more sensitive than T3, T4. So many times people who have thyroid disease, in their report if you see, the T3 and T4 levels may be normal or subnormal. That means it's a range, right? Always the levels are in a range. So it is at the lower end of the range. But the TSH would be raised. So the TSH, even if it is raised a little bit, being a sensitive test, the combination of TSH raised with T3, T4 normal but at the lower end of the normal range or below normal indicates hypothyroidism. Opposite of that, TSH coming down, T3, T4 going up or going towards the upper end of the range will mean hyperthyroidism. Alright, now there are two types of diseases that are. One is called subclinical hypothyroidism or hyperthyroidism, which is only recognized basically on the blood test. And the other is clinical, that means the level of thyroxine goes up or down, causing symptoms. Now, if the level of thyroxine goes up, what will happen? Patient will become irritable. The body temperature will go up. He will lose sleep, insomnia. He will have loose motions because the intestine is working faster than normal. His heart rate will go up. Blood pressure will go up. These are symptoms. That means everything is gone up. And if he is hypothyroid, what will happen? He will lose weight. Usually hypothyroidism is more common in females. Hyperthyroidism is slightly more common in males.
Okay.
So females, they start losing hair. They put on weight. They become dull. Their voice may become low. They feel sleepy all the time. The heart rate becomes low. They put on weight and there is swelling in the feet. All these signs are hypothyroidism. So clinical hyperthyroidism and clinical hypothyroidism and subclinical. Alright. Now how is this important? Other than that it is a disease in itself. So hyperthyroidism has two drugs which you can give, which are called thiouracils. Okay, thiouracil, which bring the level of thyroxine down and treat the symptoms. You can also give beta blockers, which are common drugs which are given in blood pressure. So they will bring down the pulse rate and bring down the blood pressure. So a combination of beta blockers and anti-thyroid drugs can reduce the thyroid level. In hypothyroidism, you have to give thyroxine tablet, which is very common. It is far more common than hyperthyroidism. So you have to give these thyroxine tablets. A lot of people, if you find, they'll say, "Mere ko thyroid hai, I am taking thyroxine tablet." So the dose is 0.25 micrograms, 0.50 micrograms, or 0.75 micrograms. Right? So you have to take these tablets every day, because if you don't take, then the thyroxine level will fall. So it's a replacement therapy. Okay? So in the case of hyperthyroidism, you can use a tablet called neomercazole. Okay, neomercazole. Okay, that is carbimazole and thiouracil. These are two drugs which are used. In that, the common drug used is a carbimazole called neomercazole, which is commonly used. And in hypothyroidism, you have to use thyroid hormone, which is thyroid hormone and thyroxine directly you take. Like you take insulin in diabetes, same way. Okay. Now, what I wanted to highlight over here is that a lot of people who have diabetes also have hypothyroidism. So what is the relationship between thyroid and diabetes? I just wanted to highlight on that because people need to understand this.
Sure.
So what is found is that if the TSH starts going up, that means indicating it is hypothyroidism, there is an increased chance of the person developing diabetes mellitus type 2. That is maturity onset diabetes. There are two types of diabetes. Diabetes which is happening in children, which is called type 1, which is insulin dependent, where there is no insulin produced in the body. And type 2 is when you grow older and you put on weight and the insulin is there, but it is falling deficient because it is not efficient. And the common diabetes is the type 2 diabetes. Now in type 2 diabetes, which is 90% of the times, 10% is only type 1. So we can discuss type 2. In type 2 diabetes, what has been found is that for every 1 millimicro per liter of TSH rise, there is an increased incidence of diabetes. Okay. There's another test of diabetes which is called as glycosylated hemoglobin, that is H1BAC. That is the range is between 5 to 6 normal. Anything above 6 means indicates diabetes. That what it does, it measures the average blood sugar over the last 3 months. So some people might fast and go for a test and the blood sugar may come normal, but if you do glycosylated, they'll find that the glycosylated is 7 or 10, indicating that the average blood sugar over the last 3 months is raised. So both the blood sugar level and the glycosylated tend to get abnormal as the TSH starts rising. Now in the body, the thyroxine are two types. It is bound to the proteins in the blood, which is called the bound type, and then the free type. Majority of the thyroxine is transported in the blood, bound to the proteins in the blood. Very little quantity is free thyroxine, which is the active form. So you have a free T3 level, which can be also tested in the blood test, and a free T4 level. Just like you have T3 and T4, that is total, and the free component is also can be measured in the blood test. Now the ratio of T3 to T4, that means T3 upon T4. If that ratio goes up, it is very sensitive test to indicate that either the person is pre-diabetic and likely to become diabetic, or it is already got diabetes, or that the diabetes is not getting controlled. That means a persistent high ratio of TFT3, free T3 to FT4 indicates that diabetes is not properly controlled, just like the glycosylated hemoglobin. So if you take the 3 tests, blood glucose, glycosylated hemoglobin and free T3 to free T4 ratio, this is the most sensitive. Next comes glycosylated and last is the actual blood sugar. Okay, so this is the second part. Now what is the role of this thyroxine? Thyroxine stimulates the beta cells in the pancreas to produce insulin. So it has a direct effect on producing insulin. So if the thyroxine level falls, what will happen? Insulin level will fall. So that is the reason why If there is hypothyroidism, patients develop diabetes. That is the point number one. Second, it also has a role directly in glucose metabolism and lipid metabolism. Means, what does insulin do? Insulin, whether even from outside or produced in the body, what does it do? It utilizes the glucose which is there in the blood, right? How it does? It transports the glucose to the liver, and then the liver it converts it into energy, or it transports it to the muscle and converts it into energy, or it transports it to the fat tissues and stores the glucose there for later use. So when you exercise, what happens? The glucose from the liver and the muscles gets used up.
Correct.
Then what will happen? Because there is no glucose, so if you are fasting and exercising, what will happen? The blood glucose which is stored as adipose tissue or fat gets mobilized and comes into the blood. That's how you lose weight, and that's how you can control the blood sugar. Because whatever food you are taking, that glucose is being utilized by the way of exercise or dieting. So you are reducing the intake, so the glucose as it is low, plus you are exercising. So you are utilizing the glucose. So there is a deficiency of glucose created, allowing the glucose from the fat to come into the blood to maintain the glucose level. That's how the fat levels come down, that's how the weight comes down, and the glucose gets better controlled. Now this T3 has a role in increasing the glucose in the muscles and adipose tissue.
Okay.
That part. And it also stimulates the secretion of leptin, which is a hormone which controls the cholesterol and the lipid level. Now this is all interrelated. Diabetes can lead to dyslipidemia, that means lipid levels going up and down, and also the blood sugar going up and down. So the T3 helps in controlling the lipid levels, it helps in controlling the blood glucose levels, because it increases the utilization of glucose and stimulates the insulin in the body. Hence, whenever there is low thyroid hormone, it will increase the diabetes or precipitate the diabetes, but in 6 to 20% of people, there is always a hypothyroidism seen along with diabetes. Now why this wide range of 6 to 20%? Because there are many factors. Age, how much weight is there, what is the height to weight, BMI, body mass index, what kind of food, what are the other illnesses, whatever. But what is commonly seen is in females who are elderly, like 40 and above, who are overweight, so fat. So fat females of 40 and above tend to get hypothyroidism and hypothyroidism associated with diabetes. Or they get diabetes and they have associated hypothyroidism. And I have seen in clinical practice a lot of patients, many patients who have diabetes are also taking L-Thyroxine. So I just wanted to highlight this, that people understand that thyroid is not isolated. It is a very common organ involved in a very common disease, which is diabetes. And now in the next episode, we'll discuss about thyroid as a surgical disease. That means where it becomes a goiter, and what are the different types of goiters and what are the different types of treatment.
Sure. Alright, thank you so much, doctor. So here, doctor explained us very briefly about what is thyroid, how it controls all the
functions in the body,
and how important it is, the levels of the thyroid and stuff. So in the coming episode, we'll come back to the lumps.
Yes,
or
the
goiter,
tumors.
tumor. So if you like this episode and if you have anything to share or ask, please let us know in the comment section. Do share, like and subscribe to our channel, and stay tuned.